Welcome back. You're still tuned into Trading Hour on CNBC-TV18. A sharp fall is what we are seeing. The Bank Nifty is down 130 points as we speak. Even the mid-cap index that has turned into the red. So that index is down 41 points as we speak. Nifty at the day's low. So yes, some selling pressure which has intensified from the top as well. With that, let's move on and talk about the pharma and the hospital space now. Occupancies in hospitals could rise significantly with international patient numbers now higher than pre-pandemic levels. That's the word coming in from Dr. Raghuvanshi of Fortis Health, who speaks to CNBC-TV18's Ekta Batra at their flagship hospital in Gurgaon. Here's a slice of that exclusive conversation. Listen in.
Recovery is happening, but not only recovery, it is taking over the pre-pandemic levels, the growth levels, and that was expected because last 2 years have been a little muted, and we would expect that at this point of time we would see some growth. For example, in the international patients, we are seeing a growth much higher than the pre-pandemic level. Occupancy levels currently have come back to about 70%.
Okay, so I'm just going to get to the international revenue bit in just a bit, but I just wanted to focus on the occupancies. They've come back to 70%, but how much of it is actually pent-up demand?
I don't believe there is any more pent-up demand. We saw it in the first quarter that some of the specific procedures, like for example the joint replacement procedures, they went up abnormally high, but that sort of settled down within 2 months. And now we see that all the specialities have come back to a similar pattern as it was pre-pandemic level. So my belief is that whatever pent-up demand was there has already been taken care of. So whatever growth we are seeing today is true growth.
Okay, so what do you think has changed from COVID-19 to now? Because you're saying that pent-up demand is probably out of the way now. So what has changed in terms of health awareness in India?
So obviously insurance penetration has gone up because of the awareness levels of how healthcare can be devastating for economic expenses for the family. So that has happened. Another thing which has happened is that a lot of simpler procedures or routine procedures are today happening in periphery, in smaller hospitals all across the country, and more complex cases which require more attention and are typically much sort of complex are coming to hospitals such as ours.
Okay, so there is more complex procedures which are coming in, more insurance penetration which has taken place post-COVID-19. Occupancies, like you said, have moved up to around 70% versus around, say, 65%. Where do you expect it to probably sustain?
So we expect to go to about 75%, but there would be always variations. So there are cyclical variations through the year. The festival season typically would see a suppressed occupancy number. Like for example, in the fourth quarter, typically we see the occupancy dip a little bit. But overall, I think we expect it to be around 75% plus.
Okay, what about the average revenue per occupied bed? Where does that stand currently?
So that is an interesting question because the average realizations have remained high, and quarter on quarter you would see that there has been some growth, and that is not because of pricing. The pricing changes we haven't done for nearly 2 years.
You haven't changed prices?
We haven't changed prices for almost 2 years.
So you're seeing more volume growth?
We are seeing more of equity growth. As I was saying earlier, the complex cases are coming more and more, and that is increasing the ARPOB significantly.
So where does it stand currently?
It stands at about 1.9 crores on an annualized basis, and I expect it to rise from there further, because sooner or later we will have to do some pricing corrections as well.
When do you think this pricing correction can come?
We are thinking more in terms of the next financial year, early next financial year.
And would that be for more of the complex procedures? Because your surgical revenues have done extremely well. It's at all-time highs. Is that where the price hike will probably come through?
It would be across the board. But it would be modest, I would say.
So what is modest? Sub 5%, 5 to 10%?
sub 5%.
And that was a piece from a very special series we have planned for you, Medicine Box, a deep dive into the world of pharma and healthcare. Catch snippets of this conversation all day today only on CNBC-TV18. And with that, it's a wrap on this edition of Trading Hour. Stay tuned. Halftime report comes up next.